Good morning, everybody. My name is Heidi Rowell, and I am the Executive Director for Home Matters Caregiving, as Mike mentioned. I have been in long-term care, I always hate saying this, but about 20 years. So I know, that's where I started my career. So I started my career as a CNA and fell completely in love with working with older adults. And so I stayed. So I've worked in many different care settings and I've worked in nonprofit, but my true favorite care setting is in-home care. So we're lucky enough to work with the folks at Choice Advisory quite frequently because there are those people that hear all of those care options that Julie just mentioned, and they say, none of that is for me. I want to be in my own home. I don't want to play bingo. I don't want other people in my space. So those are the people that we take care of, or people may just not be ready yet. So we work with a lot of folks that maybe they do want to move to one of those care settings eventually, but they're not ready yet. And so we provide home care services for them up until that time. So I'm going to do a little bit of a home care 101 overview for you, talk a little bit about Oregon specific. Oregon has some very specific rules and regulations that govern in-home care so that you all can be educated if any of you are thinking about having in-home care. How many of you are like just considering maybe having some in-home care in your home? Perfect. So this will give you some ideas of what you should be looking for, what agencies might be a good fit for you, what you should be asking. I'm just going to go ahead and click got it here. I know we're recording. So the first thing is, what is in-home care? So in-home care is the care related to activities of daily living. So that's your mobility, your eating, toileting, bathing, hygiene, dressing, grooming, and cognition. So just like Julie mentioned with the housing, these services are typically not going to be covered by medical insurance or Medicare. They don't require a physician's order. So I'm sure many of you are familiar with home health. Home health comes out for kind of those short visits, maybe if somebody's had a recent fall or hospitalization. Home health might come out, do some physical therapy, maybe some nursing visits. So we are more of that long-term care that people are looking for. Typical funding sources, private pay is going to be the first funding source that we generally use. Long-term care insurance, if people are lucky enough to have those long-term care insurance policies, we absolutely work with those. VA benefits, some agencies actually have a contract directly with VA in addition to aid and attendance. People are able to work through their VA to get paid, get their home care agencies paid, and then finally Medicaid. Not every agency in Oregon has a Medicaid contract. Similarly to what Julie mentioned, it's more difficult to find care with a Medicaid contract, but it is possible. So Oregon has different levels of licensure. So you're probably thinking, well, home care, it's home care, they're all the same. So probably, I don't know, 10 years ago, they decided to level the agencies so that people would understand who they were working with. Because what was happening was I think right now we're up to 190 licensed agencies in the state of Oregon. That time there was probably 160 licensed agencies in the state of Oregon. And you would have anything from an agency that had absolutely no clinical staff, only did companion care, really great at taking people shopping, no nurses on staff, all the way up to an agency like ours with 2 nurses on staff, an administrator who has a degree in healthcare administration, occupational therapist. So you have this huge wide gamut of agencies, and there was really no way to tell who could do what. And agencies that didn't have the clinical expertise were taking on clients that they weren't able to take care of. So they instituted this licensure level. So it goes from limited all the way up to comprehensive. And I'll just do a quick brief overview of what each of those levels mean. So the limited agencies they are able to provide personal care services. They can do medication reminding, not medication administration. And I'll spend a little bit of time on the nuances between reminding and administration for you. And caregiver training is required and has to be provided by a qualified entity or individual. So we have rules in Oregon about who can train our caregiving staff, and that's fairly new also. The basic agencies, so that's the next level up. So the basic agencies can provide the same personal care services, medication reminding. They're also able to provide medication assistance, and then they have the same caregiver training requirements. Medication assistance is a different level of medication management. So when you're doing medication reminding, that's simply saying, hey, did you take your meds today? That's it. That is a medication reminder. Very quick, very easy. It's not going back again and checking. It's a very brief process. Medication assistance is for people who cognitively are able to manage their own medication process, but maybe they need some help opening the bottles. So if someone is living with Parkinson's and you know exactly what you're trying to take and when you're supposed to take it, but you can't quite get those little bottles open or get your pill box open, that's medication assistance at that point. Does that make sense? Okay. And then we have the intermediate level. So intermediate levels can provide all of the same services that the other two can provide, but they can step up to medication administration. So when an agency is doing medication administration, you see there's a new requirement there. They have to have a registered nurse on staff. And that registered nurse oversees the medication training program for the caregivers. They oversee the medication administration program for the clients. They do evaluations on the medication and make sure that everything is safe and happening as it should be. So medication administration means that we have doctor's orders in place. So the agency needs to have an order to give the medication. So this is where families sometimes are like, oh yeah, mom's been taking vitamin B12 for years. You know, it's right here, go ahead and give it to her. It's not a prescription. And of course, with an agency giving that medication, we do need to have a prescription for that, which is very easy. Our nurse manages that. They reach out to the doctor's office, we get an order for it, and then we document everything on a medication administration record. Great for families when you're working with an agency that's giving the medications because you have a documented list of what has been given. You don't have to wonder when you get home from your outing, was this medication given? Was it not given? Because it's documented on the medication administration. Again, same requirement that caregiver training is required and has to be provided by that qualified entity. And then the last one is comprehensive. So this is the highest level of licensure that we have in the state of Oregon for in-home care agencies. So what's added there, you can see the same services. What's added there is nursing services. So this is the level of licensure that our agency has. So when you have nursing services, that means that our nurses can go out and do things for people. Sometimes it's foot care, sometimes it may be some wound care. We can also do nurse delegated tasks. So agencies that carry a comprehensive license can do delegated things, which looks like insulin. So if anybody is diabetic, the nurse can delegate the caregivers to be able to help that person with their insulin administration needs. So that's the difference with the comprehensive and the intermediate, because those can look very similar. So it's great for you guys to know as you're shopping for agencies what that level of licensure is. And the reason why is that, you know, many clients who have Parkinson's disease are going to require some level of assistance with their medication. So even if you're sitting there today and you're like, hey, all I really need is somebody to be here, somebody to maybe make meals, help with ambulation, the person I'm caring for, or yourself, I'm able to take my own medication independently right now. But there may be a time in the future when you need that help. So if you think there's going to be a time in the future when you need that help, it's great to ask the agency, hey, what's your level of licensure? And then you know, okay, today my care plan looks like this, but in the next, you know, several years, it may change, or over the course of a year, it may change. And this agency is capable of providing more services with me as my needs increase. So the other thing we talked about, I said I'd talk a little bit about the difference between medication reminding and administration. So a lot of times when we work with families, they'll say, oh, I don't need you to administer the meds. I put everything in the pill box for them, and all you need to do is remind them to take it. So in the state of Oregon, our rules state that if the person who is being given the medication doesn't know what they're taking, why they're taking it, when they're supposed to take it, how they're supposed to take it, and how often they're supposed to take it, all of those things, which are the 5 rights of medication administration, if anyone cares. All of those things the person has to know, and if that person doesn't know even one of those things, then the state says, oh, you're actually administering the medication. Your caregiver is responsible. So that means that we actually do need to have those doctor's orders, and we do need to have those medication administration records in place. And that's for safety. Because if the person doesn't know exactly what it is they're taking and you hand them this handful of pills, and they're like, oh, looks good to me, and they take them, but there was something extra in there that day or something that was missing, we're not going to know that. So it's really important, even if the family member wants to continue filling up the medication box and they just want the caregivers to give what's in there, we'll have that medication administration record, as will any agency with our level of licensure, so that we're saying, hey, we know what's in there, we know what we're giving, and we know that we gave the right things. So very important. Agencies with a higher level of licensure are generally able to handle more complex clients. So, if you do have Parkinson's and you have other comorbidities along with that, you're going to want to look for those agencies that probably have that intermediate or comprehensive level, because they can grow with you as your needs grow, versus an agency that will say, oh gosh, we're beyond our scope now, we might need to refer you out to somebody else. And that can be challenging, because then you have to meet a whole new person, a whole new care staff. So just as you're looking at what you want to have for in-home care, it's really important that you consider what your long-term care goal is, and make sure that you have an agency that's going to be able to match that. Home care works really closely with other services. So I thought this was an important slide to include, so we can talk about, because many people have other things going on. So we can coordinate, so we can assist. So if somebody has occupational therapy or physical therapy, our caregivers and any home care agency caregivers can assist with those exercises in between, right? Because you see the physical therapist once or twice a week, and they'll say, okay, on the days you're not with me, you're supposed to do these medications. Who's really good at doing their exercises on their own when they're told? Anybody? No. I'm terrible. I need somebody to tell me what to do. I have a really good friend. She's my accountability partner. She calls me in the morning and she's like, get out of bed. We are going to work out. But our caregivers can be the accountability partner. So they can make sure, usually PT, OT, speech will leave kind of a printed list of exercises, and the caregivers can make sure that they're helping with those during the time that they're with a client. Caregivers can also provide information. So we can provide information when caregivers are in the home. Our caregivers in particular, and most agency caregivers do this, they write notes while they're there. They document services that were provided. So they can be a great source of information. And what I've noticed is many times as the family member and you're with your loved one all the time, you're living in the home with them, you might not notice those small changes over time. And so you're like, oh, I think everything's fine. And if the caregiver is in a little less frequently, they'll notice things and they can let you know. And then you'll say, yeah, you know what? You're right. That is different than it was a week ago. Maybe we do need to talk to our medical professional. So caregivers can be a great source of information for you, for the caregiver, for the medical professionals. They're really great for that. We partner with other agencies. So we work a lot with people that have hospice involved, and we can provide end-of-life care. Caregivers work very closely with hospice, administer medications. We ensure that clients are safe and comfortable if we're providing care at end of life. And collaborative, we can provide information to the medical team about medical equipment needs, anything like that. So caregivers a lot of times have worked with multiple different types of clients, and so they might be in your home and say, oh gosh, did you know about this great piece of equipment? You should get one of those. And you're like, oh wow, that's very interesting. So caregivers can really provide a lot of great information and collaborative information. I wanted to talk just a minute about technology as well. Technology is a field that we in in-home care, we have traditionally not been great with technology. We make jokes all the time. We go to a national conference and we were joking that there's agencies that have been running their, huge operations on a spreadsheet, and they're really happy with that. They love that. But we've noticed that people need more technology in their homes, and there's a lot of areas where technology can help people to stay in their own home and stay in their own home longer and more safely. So it really bridges the gap that exists in risk management when people are discharging home or people are trying to stay home. There's more seniors today that are going to need caregiving hours than there are caregivers to provide them. So unless you've been kind of living under a rock, I think everyone in this room has heard there is a caregiver shortage. That is true. Our population is aging faster than we are replacing our population. So all of those young people that used to be down here to take care of everybody as they're aging, it's starting to look less like a pyramid and a lot more like the Eiffel Tower. So using technology can help people to bridge that gap and be able to provide more services at home when we can't have that physical caregiver. The cost of in-home care is rising. The average right now in the Portland area is about $40 an hour for in-home care if you're looking anywhere in Portland Metro. It's a little less than that in the outlying areas, but not a lot less. We're probably looking at, $35 an hour in some of the more rural areas of the state. And it allows for agencies and families to proactively look for increased risk. So we use a technology at our agency that's audio. And what it does is it gives us data on the client's baseline. So we install it when they start. It's standard of care at the agency. So we install it at start of care. After a week, it gives a report on kind of what's going on in the home and what the baseline is. And then it starts letting us know if there's anything that's altered from that baseline. So the easiest one to explain is urinary tract infection detection. So I think most of us have heard of or maybe unfortunately experienced a urinary tract infection. And as we age, that can be really detrimental to us. We start to have all kinds of other symptoms that go along with that, and it's very challenging to recover from. So this will let us know if a client might be experiencing a urinary tract infection. You're probably like, how would it do that? So great example is, say, we start taking care of a person and they tell us, hey, I get up 2 times every night. That's all I get up. And we're like, okay. We go ahead and we install the audio technology, and yep, sure enough, 2 times a night, kind of like clockwork for at least a month. And then all of a sudden it's 3, 4, 5, 6 times during the night, and maybe it's noting some distress as well during the night. And we start to see that there's some problems going on. We'll get an alert from the data, and we'll say, hey, it looks like there might be a potential urinary tract infection. We can alert you of that. You can call your doctor, get a urinalysis, and see if that's what's going on. So that's kind of the simplest one to explain. It also gives us data on medication compliance. It gives us data on cognitive decline, fall risk increase, all kinds of things. So there's a lot of really amazing technology that's out there to keep people in their homes for longer. It's an entirely separate presentation, so I could talk about it all day, but just wanted to kind of let you guys know. And then technology really allows seniors and families to use information to determine the amount of care that they need. So the way that we use our virtual assessment technology is, if somebody's not having 24-hour care, it will let us know if our care plan is correct. So suddenly we're starting to see, oh, there's really high needs at 6 o'clock in the morning, but our caregiver doesn't come in until 8. We can back that up. Instead of having to add more hours at the end of the day, we can have them come in earlier and keep the hours the same, but just adjust that. So really neat. So I would encourage you, if you're shopping for in-home care, ask that agency, like, hey, what do you use for technology? What do you have to complement your service? Because at our agency, we really like to say it's the high-tech complement to the high-touch service model. So great questions to be asking when you're out there. All right. Any specific questions to all that?
I have one.
Julie.
Do you have a minimum?
We do. That's a really good question. And most agencies do. So our minimum is 4 hours a day, 12 hours a week. So that's the smallest amount of time that will come in. And that's pretty common across the Portland metro area. I've seen a little bit smaller than that, but most agencies have about a 4-hour minimum.